Hello, I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us and making us a part of your day. Going to have a conversation with Mr. Doron Youngerwood, Director of Marketing at SysAid Technologies. He's joining us on the program to talk about their IT service management solution software that provides a suite of tools that increases efficiency and also improves patient care. Welcome to the program, Doron.
Thank you, Neil. It's great to be here.
Now, I mentioned that you are Director of Marketing at SysAid Technologies. Talk about SysAid Technologies and give us just a bit of background about yourself.
Sure. So SysAid Technology is a global ITSM provider. ITSM is IT Service Management. And in a nutshell, what that means is it's all about providing simplicity to IT departments as well as end users across organizations, especially healthcare providers. We've been around 17 years, and we use our software, service management software, to really effectively improve productivity, enhance efficiency for healthcare providers, and what we like to call back-office digital transformation. That's really what it's all about. The whole concept of digital transformation is well understood, certainly from the front end of how it impacts end users, but it's kind of the under the hood back end side of things. That's really where we're focusing on.
What are some of the challenges in that back office environment that you're talking about when it comes to IT solutions and management?
Well, you may be surprised to know that still in 2019, many organizations across the different industries, certainly healthcare industry, are still using pen and paper or Excel spreadsheets, still very manual to track and manage many processes across the organization. And so this is all about really elevating that to improve the overall experience for both IT departments, but also for end users across the organizations.
In your opinion, what would you say that the reason for this slow transition among many organizations, especially in healthcare, why are they still using this outdated method of tracking and management, pencil and paper?
That's a good point. I think it's just a lack of awareness over what can be done. I think you're all aware that when it comes to change, people don't like it. They'd rather stick to what they know, even though there might be a better way of doing things. And I think there's so much awareness and understanding over digital transformation and technologies that impact us as an end user, and less is understood about how you can leverage the same capabilities for the behind-the-scenes back-office technology as well, and back-office scenes.
What about healthcare practices that are still, compartmentalizing their IT? For instance, the psychology department has a system of their own. The cardiology department has a system of their own. Are there still, does that challenge still raise its head when you're talking with your clients?
Yeah, it does. It certainly does. And it's very much a fragmented experience, is what we see. And it seems that in many cases, different departments within a healthcare organization are not necessarily communicating with each other to understand best practice, to leverage the same tool. So really, ultimately, it's all about improving patient care rather than spending huge amounts of time and effort on what we call administration.
Mm-hmm. So you get in there and you kind of break up that administrative cartilage, as it were, to make things flow a lot smoother, a lot faster, thereby, caring for the patient a lot faster in a more efficient way. Talk about how your company, SysAid, brings these departments together under one umbrella, thereby increasing efficiency.
Yeah, sure. So let me give one example. So we're working with St. Patrick's Mental Health Service. They're Ireland's last independent provider of mental health services. And one example is they are using us, and in fact it was the chief pharmacist that came to us originally, who wanted to use SysAid to enable clinical staff to really log and monitor medication queries, and use that to automatically print them onto customized stickers for patient files. And the idea behind this was to, firstly, work more efficiently, enable all of the pharmacy's clinical incidents to be categorized and provide a much easier experience for the staff, for the pharmacist to identify recurring incidents. That's one example.
Now, when it comes to urgent care, is urgent care a large leap from, say, an established, 350-bed facility when it comes to IT?
It certainly is. It certainly is. And you reminded me of another provider, North York General Hospital, who use SysAid across 3 hospital sites, including one of Canada's busiest emergency departments. So, of course, time is of the essence. And they really wanted to, using the analogy of doing things faster and better and quicker. And that's ultimately what they wanted to do. Time was of the essence. And the idea behind using SysAid was, with our automation capabilities, we were able to free up their time because, of course, the IT department were absolutely bombarded by requests and tickets like they are across many healthcare providers. And they simply weren't able to manually route the different tickets to the most appropriate IT agent or service desk agent. The other thing, of course, to bear in mind in an emergency room is we talked about timing. And by having SLAs, service level agreements, which is what they had, they were restricted to making sure that they resolved issues in a timely manner. And of course, those issues depended on who was raising the request and which department, et cetera, et cetera. And so having automation really enabled them to free up their time. So, for example, if a ticket was raised, if a piece of equipment went down, it wasn't working properly, they had a certain time to resolve that issue. And with automation, if the ticket was not actioned or resolved within a certain time frame, it got automatically escalated higher up. And by doing that, it meant that they were able to resolve the issue and ultimately improve the experience for the patients.
So taking that human determination as to what is or what is not priority is eliminated with your system.
Exactly. Rather than leaving it down to the discretion of the service desk or the IT department, it's all about ensuring we can free up their time, ensure we're resolving incidents and problems in a timely manner to really improve the patient care.
Now, in the beginning of our conversation, you said that SysAid Technologies is not exclusive to the healthcare industry. What other industries do you serve, and are those industries related to healthcare? So
another industry that comes to mind is the education sector. And there's a fair amount of similarity, although probably less pressure within the education sector, but there are some similarities between the two, between colleges, universities, and schools across the world. And that comes down to using self-service capabilities. We're living in a world where users want to be able to take control over what and how they work and engage with self-service capabilities. So in this example, of course, with healthcare providers, you have doctors and medical staff as well as patients able to use self-service portals to raise a request or request a new feature, new functionality. The same with schools and colleges. It's exactly the same thing. If you want to order new equipment, new furniture for a classroom, whatever it may be, new books, again, we made it easy for students and staff and teachers to be able to do that using self-service portals. So that there's an analogy and a kind of alignment between both healthcare as well as education in that respect.
Doron, where can our listeners go online and get some more information about SysAid Technologies and get some more information about ITSM in general?
There's lots of good resources out there. I would start with SysAid.com. We have lots of great articles. We really focus a lot on producing blogs and thought leadership pieces to really ensure that organizations can understand the value, and also some tidbits and tips as to how to get the most out of IT service management. And the second would be HDI. HDI is Help Desk Institute. Again, another good resource and portal for lots of really good content out there. I think they're two good places to go to.
Thanks. Doron Youngerwood, thank you for joining us here on Health Professional Radio for this Health Suppliers segment. It's been a pleasure.
Thank you, Neil, for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.